As South Africa heads into level 2 of lockdown, interprovincial travel has opened up again, and that includes domestic air travel. There is, however, no great cause for concern, as experts have found that you're more likely to pick up the coronavirus in a shopping center, office, or airport itself than on a plane where air filters are highly effective at removing the virus. A research letter by German scientists analyzed the transmission of the coronavirus on international flights, where a tourist group with infected members were amongst the passengers. Their case study focused on the flight of just under 5 hours from Tel Aviv in Israel to Frankfurt, Germany on a Boeing 737 with a total of 102 passengers. The flight took place in March. Before measures like masks were implemented, the group was tested for the virus on arrival in Germany, and 7 were found to be positive. 4 of them had shown symptoms during the flight, 2 were pre-symptomatic, and 1 remained asymptomatic. They then interviewed 91% of the passengers who were on that flight, checking for COVID-19 symptoms and antibodies 9 weeks after the flight. Of these passengers, 2 tested positive, while 7 reported having COVID-19-like symptoms within 14 days of the flight, but tested negative for the antibodies. I'm Howard Feldman, and this is your weekly Synthesis podcast. Joining me, as he has done each week and each Sunday, is Dr. Anton Meyberg. Our focus today, what is and what is not safe? It's August the 23rd. Welcome. Let's begin with the stats. Good morning, Dr. Meyberg. Where are we along our COVID journey?
So currently we're sitting on 23,390,690 cases worldwide, with 808,783 deaths and 15.9 million cases resolved. The United States has 5.8 million cases with 180,000 deaths, and South Africa is sitting on 607,045 cases with 12,987 deaths, with 3,707 new cases in the last 24 hours. There are currently 3,230 cases in Gauteng hospitals, with 470 in ICU and 243 ventilated, and the remissions and recurrences and the actual deletion of the virus is down to 82%. So if we look back at the numbers, the first 100,000 cases came within 110 days, the second in 14 days, the third in 9 days, the fourth 100,000 came in 8 days, the fifth in 9 days, and now the latest 100,000 has come in 20 days. So we're definitely on a downward trend of the virus, as long as people take the precautions and keep things going in the right direction.
All right. And just tell us again, or as you do every week, what are you seeing at the hospital this week?
The numbers are down dramatically. I think you've still got to understand there are still people dying from COVID. There were over 200 deaths from COVID-19 yesterday. So the virus is out there. It is still spreading, albeit we are seeing less cases in the hospitals at the moment, and that's why there's less testing being done. There's still a lot of virus outside at the moment. You still have to wear your mask. You still have to social distance. You still have to wash your hands and sanitize and be careful. That being said, we are also starting to increase the amount of elective surgery done in hospitals at the moment because we can at the moment.
And you're comfortable with that?
Very comfortable.
In fact, because one of our questions is from a viewer who needs to have elective foot surgery. She postponed it and was informed by the doctor that she now can proceed. You would be comfortable to say,
look, you understand now's the window if you're going to do it, because we don't know what's going to happen in the next 4 to 6 weeks. If people's behavior is good and if people follow the rules and do things properly, then we will not see a second surge. But if they don't, then in 4 to 6 weeks, we most likely will see a second surge.
Okay. And where are we with regard to treatment?
So the treatment is currently unchanged at the moment. There's nothing dramatically new that we're using at the moment. There's lots on the horizon, but there's nothing different. We're still using the same medications with regards to remdesivir, tocilizumab, with all the vitamins, with the dexamethasone and corticosteroids, oxygen, high-flow oxygen, nasal oxygen, and ventilation if necessary.
One of our listeners, Helen, says, what does Dr. Meyberg think of the use of the drug, is it Avamectin?
So
Avamectin?
I think you've got to understand that that's still controversial. The drug study came out at the same time as the study of hydroxychloroquine, which was published in the Lancet by the same group of people that did that study. Avamectin is a drug which is an antiparasitic drug, which we've said previously is used to treat river blindness, filariasis, scabies, all those parasitic conditions. It's used by the vets, and they use them in cattle in different dosages. There is some warrant to using it, but there's no peer-reviewed studies that show us there's a dramatic improvement in the use of it. It is being used in the national guidelines in Peru, but nowhere else in the world.
So as a matter of course, you would follow a certain regime. It's only really perhaps, and I don't know if this is correct or not, you can correct me, is if things aren't going well that you might try different methodology. Is that right?
So when your back's to the wall, then yes, sometimes you do try different methodology. But the treatment regimes we've got at the moment are the best we can hope for at this point without a vaccine being available and without the golden drug. None of these drugs are effective treatments, but they all help in the treatment of the virus.
Right. And what you're seeing is relative success with the treatment,
Correct.
The treatment that you're using.
Correct. I think we've got to understand that, you know, if you look at the numbers and you look at the mortality rates in South Africa and the projected mortality rates, there's got to be something in the treatments that we're using and the fact that the lockdown worked and helped us getting ready for this, because we're nowhere near to what was projected, and our numbers are dramatically down with the mortality rate that we expected to see.
This is a very strange one. Carla says, are males more at risk than females? Studies suggest that males are now being put on estrogen.
So the males are more at risk because they've got a decreased T cell response, whereas different to females have got a greater T cell response, and T cells are memory cells. There's also a link between androgen and the testosterone that people with no hair, present company included, have got a higher risk of getting the virus. But we are seeing everything's a comorbidity for hypochondriac. But we are seeing that certain people, that male or female, when they're sick and they're in ICU, it makes no difference. The disease hits you and it hits you hard. The numbers aren't dramatically different in South Africa, but worldwide there's definitely more preponderance to going towards males over females.
Brenda wants to know, what can one take instead of zinc if you can't take vitamin A and K because you're on blood thinners?
So zinc is one of the binding agents with retinol and vitamin A. It's all in the same process, but there's no reason why you can't take zinc if you're on blood thinners. You've got to remember, we're using zinc in our treatments for people with COVID, and at the same time we're using anticoagulation, whether it be drugs like Clexane, warfarin, Xarelto, Arixtra. So we're using it at the same time. So there's no reason why you can't take it. It's not a vitamin K antagonist that antagonizes things like warfarin. So you can take zinc if you're on anticoagulation.
I know that there's been a shortage of calciferol, the vitamin D medication. What should one do if one can't get hold of calciferol?
So calciferol is generally taken once a week in a dosage of 50,000 international units. If you can't get hold of it, then go for the daily vitamin D, which is 3,000 to 4,000 international units daily, and you can get that anywhere at the moment.
Right. Okay. And obviously, I'm assuming that calciferol is in short supply because of the demand over this time.
Correct.
Right. But it is important to continue taking.
Definitely continue taking your vitamins, taking all of that whole sort of vitamin C, zinc, thiamine, niacin, all of those vitamins that we need to take.
Right. Helen also wanting to know, how safe is it to swim in the sea? Assuming people are starting to go away. We spoke a little bit earlier about the fact that interprovincial travel is now allowed.
I think it's very safe to swim in the sea as long as there's no sharks or jellyfish. I mean, I don't see a reason why you can't swim in the sea with COVID.
So that's your danger.
Yeah, your danger is not COVID-19 swimming in the sea. As long as you social distance, then there's no issue swimming. Maybe.
Right. So that's definitely,
yeah, there's no issue.
All right. And another strange, not strange, but a study that we saw was that, in fact, a Business Insider reporting on this, and I wanted to ask you about this, that the headline is, we just got the best evidence yet that everyone develops long-term coronavirus immunity after infection. I don't know if you've seen these reports.
So this is a great study that's come out. Now, I think we've got to go back. We've been discussing, all we've been discussing over the last few weeks is antibodies, but we haven't had enough evidence to discuss what the T cell side of the story is. So there's two different layers. There's an innate immune response, which acts within minutes of infection. That's a rapid response. And this triggers your adaptive immune response. Now, the adaptive immune response consists of your B cells and your T cells, which acquire specificity and memory, which is the basis of your vaccination. So in COVID patients, if you follow them over time, their antibodies do seem to decrease within 2 to 3 months. But according to the study, this is not a cause for alarm, because at the beginning, the antibody levels peak. And then after a few weeks, they decrease. But you still have what we call a T cell response. Remember, the B cells cause the antibodies, the T cells cause the T cell response, which are the natural killer cells which kill the virus and prevent the virus from actually replicating. So if you have a T cell response and a B cell response the first time, then the second time you're exposed to the virus, you mount a rapid immune response, so that likely you won't be affected dramatically, because it's believed that you will develop these T cells that will protect you against the virus. Now, this is far outreaching, because it also means that we're seeing that people who've had previous common colds and have been affected by corona, not COVID-19, but the 4 different subtypes of corona, there's definitely a cross-link between the corona and the COVID-19. So you could have T cells that are protecting you. And that's why if you're getting sick and you've had this corona before, you might not get sick as predicted. So I think the waning antibody response is not a huge concern. The concern is the fact that we don't know how long the antibodies last, and we don't know how long the T cell response lasts, but it is a very, very promising report, this.
So would you still be of the view that if you have been COVID positive, you have suffered from COVID, that you still need to take the same precautions until we have more clarity around this?
You still need to take the same precautions, because we don't have herd immunity. So we don't have everybody else protected against you. So it may be safe for you, but it's not safe for other people. And that's the important point. You can still transmit to the virus. I think we will get, you know, the World Health Organization has stated that they think we'll end this pandemic within 2 years. We don't listen too much to the World Health Organization, because they've got to have a meeting after a meeting after a meeting before they decide if they can actually make a statement. But we're hoping that the vaccines will come out within the next few months, and we will get herd immunity if people start taking the vaccines. Remember, if your antibodies do wane, then you get a booster vaccine to push up your antibodies. So there's promise out there. The amount of time it's taken to develop the phase 3 trial studies for these vaccines is extremely short in comparison to any other vaccines developed in the world before. So there's big promise out there.
All right, and just to preempt this, on Tuesday evening, Anton Meyberg and I will be chatting to an expert who is very involved with developing the vaccine out of San Francisco. We're going to be recording that on a Tuesday evening, and we're going to post that podcast following that discussion. So that's going to be an in-depth discussion on the vaccine process, the different approaches, and where we are. So do watch out for that. Make sure you've subscribed to this YouTube channel so that you are alerted when these podcasts become available. So Anonymous says, I wanted to find out from Dr. Meyberg, I have a history of susceptibility with viral infections and have had issues with shingles, H1N1, Bell's palsy, which 4 years later have not cleared up and still flares up from time to time. Up until now, I have had instruction from my GP to remain at home due to the possibility of being immunocompromised. Would it be okay for me to return to work and to take on some form of normality under level 2? I'm 31 years old.
I think you've got to understand that Bell's palsy doesn't make you immune compromised, and neither does shingles, and neither does a previous infection of H1N1. When you say you're immune compromised, you've got to look at the bigger picture. Are you on chemotherapeutic drugs? Are you on immune modulatory drugs like rheumatoid arthritis drugs? Are you on any other of these type of medications that can decrease your immunity? Are you diabetic? Have you got low immunoglobulins? Then it's a different reason. Then you can call yourself immune suppressed. But from what you're telling me, there's no reason, if you social distance, if you wear a mask, if you hand sanitize, that you can't go back to a socially distanced environment, back to work.
Mm. All right. And Crystal says many of those that I know who have been had tested positive broke out in a terrible rash that almost looked like chickenpox. My dad, who has also tested positive, got terrible shingles in his eye. He has since had to have eye surgery. I was just wondering if there's a relation between the coronavirus and the chickenpox virus.
So we haven't seen a major relation. I mean, the number of patients at this point in time at our hospital, we've seen over 600 COVID-19 patients, and we haven't seen any relation between any of these other viral infections. In other words, are you more immune suppressed that you will develop a latent herpes zoster with the shingles, that type of thing? We're not convinced about that.
All right. And let's just now talk about the fact, what the cans and can't do's, or cans and shouldn't do's, because last week, Sunday, when we recorded this podcast, we had just heard the announcements about level 2 that we were about to move into level 2. We are now in level 2. As I said earlier, interprovincial travel is allowed. We're allowed to socialize in very small groups with family, effectively. Schools are back. Places of worship, including synagogues, have started up again. Can you take us through the cans and can't do's? Let's start with restaurants, because a lot of people are going out to restaurants. Some saying restaurants are full. I'm still a little bit nervous. I have to say I haven't been to any restaurants yet, and I just don't think that I'm ready to go. But I don't know if that's my own anxiety or if that is me being prudent. I do have a comorbidity around hair loss.
So the cans are very important, okay, and the can'ts are as important. Remember that you still have to wear your mask. It's still mandatory that when you go out, you wear a mask. You still have to social distance. You still have to public distance. Now, if you're going to a restaurant, you're sitting in a restaurant with people inside a room, you all got your masks off, you're all eating, you all could be coughing, you all could be sneezing. Personally, I'm not going to any restaurants at this point because I still think it's too dangerous. If, however, you go, let's say, to a tea garden, and people are 5 meters apart and the tables are apart and you are apart and you're just a family at a table and you're away from other people, that's less of a risk and that's less of a problem. So you've got to be very clever. You've got to do what's acceptable for you and your family that works and that's within the social norms and within the rules, and you've got to respect the rules. You have to take this the rules very seriously so we don't get the second surge. So yes, you can have a meal with a family, but then do it cleverly. Social distance yourself. Put one family on the one side of the table, put the other family on the other side of the table. Social distance of more than 2 meters. Eat outside. Yep. Everyone gets their own meals so that you don't have to share cold drinks. You don't have to share bread together. You get your own little rolls. You get your own things. Everyone sits outside, they eat, and if they get up, they put their mask on, they go inside, they put their mask on, but everyone stays apart at the same time so that you can keep these rules so you can prevent anyone from infecting anybody else. You know, there's a lot of people talking about going back to gyms as well.
Yes, I was going to ask you about gyms.
Yeah. Look, I mean, if you do go back to gym, don't go shower at the gym. Don't go sauna at the gym. They are restricting the gyms to 50 people. Be very careful. You have to wear a mask the whole time. It's very difficult to do gym in a mask. It's one thing to run in a buff or a mask. And then I've got to say, this morning I saw groups of 10 people running down Craddock Street with no masks on. You know, what are people doing? I mean, this is just one way to start the next surge. People, you've got to be responsible. You've got to be safe. You know, you're in a gym, you have to wear a mask. You've got to be safe. A gym's a high aerobic exercise type of circuit that you're doing. You're going to cough. You're going to bring out all these types of things. It's not from the sweating. Yes, you can clean the machines, but you've got to look after yourselves and other people around you.
And I mean, movies have even opened up.
So now you tell me how you're going to go into a movie house. So you sit in a movie house, you isolate from somebody. There's no ventilation in the movie house. So the people sitting close, you're going to cough on you. It's just not, it doesn't make sense to do that at this point in time. We still are in level 2. We still are in a pandemic. We still are in a lockdown. We haven't lifted the restrictions. Yes, it's good for the economy, but it's very impractical of how to do it at this point.
So your personal view is, don't go to movies at this point. Jim, be very, very careful.
Be very careful, Jim. Be very careful. And if you've got any comorbidities, stay away from any of these places still. You know, we've got to protect the vulnerable. We've got to protect the people with comorbidities, because there are still people dying every single day. Worldwide, there's about 6,000 deaths a day from COVID-19. There were over 200 deaths yesterday in South Africa. We are still having a big virus replication outside of our houses. Although there's not a surge, which we don't want another surge, we still got to protect each other.
Look, more than 3,000 cases a day is still a big number. You know,
it is still a big number, but if we compare it to 11,000, there's definitely improvement, and that's why we can be a bit less strict with the rules. But being less strict doesn't mean you've got to be irresponsible.
Can we talk about places of worship? Because I know synagogues opened up this week. A lot of very, very strict rules. Definitely not easy to participate. But obviously, if you're fully committed, well, you know, you now have that option. Would you recommend that people go back? Don't go back? What's your thoughts around this?
So I think the way it's been done, I can only speak for synagogues, I can't speak for other places of worship, but I think the way it's been done is unbelievably well. It's extremely strict. Remember that the highest sort of surge of cases were in religious gatherings. So this is a high place of incidence, it's a high place of surge activity, it's a high place of virus replication. So what they're doing at the synagogues is most of the synagogues are making them go outside, which is the right way to do it. In an outside area, they're socially distancing the people, having a maximum of 15 people to start. You've got to register, you've got to be screened before, and it's done with people without comorbidities, younger people, and people who have an obligation to be there. So I think it is being done very well, and the people that need to go there can go there.
Right. In terms of travel, in terms of air travel?
Be careful. I would still wear my mask on the planes. I don't know, I wouldn't go international at this point in time, but if you have to go locally, especially for work, then you do need to wear your mask. You do need to try social distancing on the plane. I mean, I don't know how they're doing it on the planes. I don't know if they're putting people apart from each other, but I wouldn't want to sit on top of other people because there's a high risk. Even with the ventilation in the plane, we still got to be very careful.
How is South Africa doing in this regard? And of course, we're not talking about the corruption. We're not talking about the fact that a dead person, a person who's been dead was awarded a PPE contract in the Eastern Cape, because that's, you know, that could be both impressive and very unimpressive. But how are we doing in general when we look back at the last 5 months or a year down the line? When we look back at this, how do you think we will assess our own performance?
So we can look at it like a graph. At the beginning of the graph, we were up here. We started off brilliantly, and then the government dropped the ball. We went down here. Now we've gone back up to here. We're definitely doing very well at the moment, despite the government, despite the lack of direction from them. And we have to maintain it and take it forward. So we're on a good footing at the moment. We can get forward and we can open up things further down the line if we are responsible and if we follow the rules. We have to follow the rules. It's so important, it's so critical, because if we don't follow the rules, then we're going to go back to square one.
Okay, so what are your rules?
Social distancing, masks everywhere you go, washing your hands all the time as frequently, from the beginning, the same type of rules, hygiene, hand sterilization, don't interact in groups with people. If you're running, don't run in groups. And if you do run in groups, run separately, one on one side, one on the other side of the road, wearing your mask or wearing your buffs. You have to protect each other and you have to protect other people around you. Keep up your vitamins, keep up your nutrition, keep up your exercise, keep healthy. You are allowed out of your house. You are allowed to exercise, but do it responsibly.
Let's just talk about elderly people, grandparents. How do we... Now is almost a more difficult period, because how much are we allowed to, or would you say that we could see parents and grandparents, provided we're outside and obeying those types of rules? Or would you still prefer... You still
got to understand that the elderly people are still the vulnerable people. And once again, there's still a virus out there. My feeling is you still got to protect them, because they are our most vulnerable part of the population, the people that can get affected and, God forbid, succumb to the virus. So I would say still protect them. If you can't hold back and you can't follow the rules, then yes, you can sort of see your grandchildren in the garden from 2 meters away with masks. But you tell me how easy that's going to be, that you can't hug your grandchildren, you can't let them come and play with you, especially with the younger children. Obviously, if the grandchildren are 15 or 16 and you want to see them, there's a interaction that's much easier to make and a better understanding, different story. But with the younger kids, be very careful.
And in terms of maybe casual staff, CHARs, people coming in to work via taxis?
Look, I think everyone's back at school, everyone's back at shops, everyone's back at work. You can bring casual staff back in now. Just make sure they wear their masks. They do exactly. I'm going to repeat the whole thing. Wear their masks, wash their hands, the social distancing. If they're in your house, they're not in the same room as you or your domestic worker. If you're lucky enough to have a child and a domestic worker, they're not in the same rooms together and they're not interacting together. And if they are, more than 1.5 meters apart. But masks on the whole time.
One of the things that you and I spoke about last week, which I thought was a very good idea, was for each family to sit down and to determine the rules of engagement. In other words, as a family, are we comfortable socializing with another family outside? What are we comfortable as a family doing? Because otherwise it becomes very, very difficult when somebody applies social pressure. Everybody else is doing it. Why won't you meet? Why won't your kids go out with friends, etc., etc.? So perhaps you can just take us through that.
It's not only about comfort, it's about responsibility. What is the responsible thing to do so that we are comfortable in that situation? It doesn't matter what each family's got as their own comfortable thing. The comfort has to interact
as their own circumstances. I happen to have a father who isn't well, and he's very vulnerable. That means I have my family has a greater responsibility.
And you've got to make a decision as a family. What is your responsibility, and what is the effects of going as a family to visit him, etc. So it's got to be done responsibly. It's got to be done cleverly, and it's got to be done without causing vulnerability to those who are already vulnerable.
Right. Is there good news? Because it does seem lighter. It does seem like we really are getting there slowly, and will continue to as long as we're responsible.
As long as we're responsible. So some people have a deficient interferon response. And interferon is a protein that's released to inhibit the viral replication. So if they do that, you give something called interferon. This is an inhaled device that is being developed over the world, and this shuts down viral replication. So if they can get this going, this will be extremely important. If someone in their house gets COVID-19, can be used as a prophylactic medication to other people in the house. So that's the first thing. Secondly, Israel have developed a nano COVID breath test that gives results in a few seconds, which is earth-shattering news because that could change things dramatically. And thirdly, in an international club friendly last night, Liverpool beat VfB Stuttgart 3-0. What better news can you get from that? We are on the right path. There's nothing better. Dr. Seuss says, don't give up. I believe in you all. A person's a person, no matter how small. Don't give up now. We have a purpose, we have a goal. We need to preserve and improve everything and take it going forward. Be safe, wear your masks, wash your hands, social distance. Let's get this going. Let's do it.
Dr. Anton Meyberg, thank you as always. Some very, very sound advice there as South Africa heads into level 2. I'm Howard Feldman. This is the Synthesis Sunday podcast. We've been doing this for around about 5 months, maybe even more, probably even 6 months. And we will continue to do so whilst information is still necessary. Just a reminder that Tuesday evening, we will be focusing on the vaccine. We'll be speaking to an expert and researcher in San Francisco to understand where the world is in this regard. Don't forget to subscribe. That way you will know when the next podcast is available. Have a great day. Stay safe and stay healthy.